My name is Dr. Christian Mazur. I am a cosmetic dentist in Lafayette, Indiana. And my job is to help people to believe in their smiles. Sometimes that's just a slight change in the alignment of their teeth, some whitening. Other times it may involve completely redoing their smile using porcelain veneers and such. But my job really is to find that spot where the patient, person is completely all in on how their smile looks. I can think it looks wonderful. If they don't, it's not going to be the smile that they're willing to really put out there when they interact with people. But when they believe, when we get them to that place, be it aligning the teeth, placing veneers, just doing some whitening, when we get them to that place, it completely changes how they interact with people in their world every day. So a smile makeover is a term that's used very loosely, and it's kind of a catch-all phrase. It's really about feeling confident in your smile, believing in your smile, and sometimes it involves multiple things in the treatment. Maybe we're whitening teeth. Maybe we're aligning teeth with clear aligners. Maybe we're putting some porcelain in there. But really, the makeover is tailored to what it is that we need to change in order to get you believe in your smile. So when you smile while you talk, you know, you think about that. It's hard to even be angry or sound mad if you're smiling while you talk. And once you believe in your smile, you will do that. And it really just changes so many things about people. And I've seen it so many times, making over the smile, changing that smile. Maybe it's just the slightest thing, maybe it's a big case. But once we find that spot where people believe again, that is when their smile is made over because it's not just about their teeth, it's about how they show them and how they interact with their people around them. So a smile makeover can be very simple. We could just whiten someone's teeth and they can feel great about it. But there are different procedures we may do to all of the teeth, some of the teeth. One tooth may have a crown where we have to reduce a lot of tooth structure because there's been some bad damage to the tooth and we want to make it stronger. Other teeth, we may just put a paper thin veneer on that's just going to be bonded to the outside of the tooth without taking any tooth structure away. And there's combinations. Maybe we're missing a tooth. We place a dental implant and we do some kind of a ceramic substructure so we don't see any metal through that implant. Maybe we do a bridge where someone's missing a tooth and there's no bone to place an implant. So the smile makeover can consist of many different tools in our toolbox. How we use those tools, how we apply that, and how good is our lab that we can use different structures, different material types within that same smile to make it all work and make the patient believe in their smile. It's really an art in itself. So people ask me, how long does a smile makeover take? Do I have to come a lot? What are we going to be doing? The truth is, sometimes a smile makeover is literally you come in, we talk about what you want. The occlusion looks pretty good. We can just take a scan and not take any tooth structure away. You could come back in 3 weeks or so, and we could bond on porcelain veneers that are prepless. We haven't removed any tooth structure, and we're finished. That's amazing. Other times it may involve moving teeth with aligners like Invisalign first, which could be 6, 9, 12 months, maybe seeing you 3 or 4 times throughout that process before we get to the point where we would put some veneers on. And sometimes that combination will do the veneers first and do the movement afterwards, just to open up the arch and make things look wider. So it's a complex question. How long does this take? And the shorter answer is every case is different. It's fabulous when we can go in and just place some prepless veneers on the patient and they walk out and everything's fantastic. But setting up that case, protecting their investment, having the occlusion right, everybody's different. The big thing is we want you to believe in your smile. So you smile and share it with the world and the people around you. And we want it to be protected by having things aligned. Proportion plays a lot in designing a smile. There is a golden rule or golden mean that can be applied. It's been applied to different artworks and architecture for centuries. Literally, Leonardo da Vinci was huge on this. And we apply those same proportions to smiles, to teeth within the smile, and to the smile to the person themselves. And when we apply those proportions, then we can just do minor adjustments to sharper angles, rounded angles, smaller or larger teeth compared to one another throughout the smile to break it up. We can make it look really flat and wide. And it really comes down to personal preference. But when we see smiles that we like, it's not just the color. It's so many people are so caught up on color. Proportion is huge. And when we get the proportion right, those small adjustments within the smile kind of personalize it. But having proportion correct is a big thing. When we have someone that's put off cosmetic work for years because they haven't been happy with their smile, I don't believe in their smile, I would say to them that a lot of times what you're seeing that you don't like in your smile, ground down teeth or crowded teeth, are really signs there may be bigger problems lying underneath that. Like a ground down occlusion can mean collapsed jaw and breaking down of their temporomandibular joint or TMJ, frequent headaches, popping and clicking, all of those things tie back in. So tooth structure gets damaged, things are crowded or overlapped, but really we're breaking down other structures and neurologically we're suffering from headaches. So maybe putting off the cosmetics that you don't like seeing, right, is also allowing those things to get worse. So maybe it's a call to action. Let's go take a look at our smile. Let's see if some of these other things tie in, and the first step is just addressing it, picking up your phone, sending a message, looking at our virtual consultation, making a phone call. That might be, like 20 years ago, you make the phone call. Today, you just text or send a message. Either way, it's just pick that phone up that's in your hand and take the first step.